Depression and anxiety are two different medical ailments, though it is very common for an individual suffering from one to also have some form of the other. In fact, depression is listed as a symptom of anxiety disorder, and anxiety is listed as a symptom of depression. It is actually quite rare to find someone who suffers from one, but not the other. It can be very difficult to treat an individual suffering from both depression and anxiety, as it can be a real challenge to determine the root cause of each. Did the depression bring on anxiety? Did anxiety bring on depression? Trying to pinpoint the starting point and creating a timeline of symptoms will help your doctor be able to come up with the most effective medical treatment plan for your depression and anxiety. A recent study showed that approximately 85% of people suffering from a major form of depression were also suffering from generalized anxiety disorder, GAD. Another study showed that one of the top contributing factors to developing depression is having some form of anxiety disorder. The unfortunate part is that when a patient is suffering from depression and anxiety at the same time, the recovery process is much more difficult and time-consuming. The patient is also a lot more likely to relapse back into depression and/or anxiety than individuals with only one of these ailments. People suffering from depression and anxiety are often misdiagnosed, since the symptoms of both are very similar. The symptoms of anxiety disorder are generally more pronounced, so it is somewhat common for the depression to go undiagnosed. This can make the situation much worse, and could potentially lead to a very serious condition. It has been estimated that only about 1 out of 5 people with depression and anxiety get the proper treatment for their condition. Depression can give an individual a great feeling of sadness. Things that usually make the person happy will bring them no pleasure. People suffering from an anxiety disorder are constantly in fear and worried. When depression and anxiety combine, not only do the symptoms stack up, they actually create new ones, such as making the person feel nervous and agitated. Depression and anxiety symptoms can make it difficult for the patient to sleep, which only compounds the illness. While there are currently no drugs on the market that are specifically designed to treat both ailments, doctors often prescribe a type of antidepressant known as a selective serotonin uptake inhibitors, SSRIs. These have been proven to help with all forms of anxiety disorder in addition to treating the depression. There is no one treatment to alleviate depression and anxiety. Instead, patients must follow a proper treatment plan including medication, dieting, exercise and therapy. While it can be a difficult and time-consuming process, it is possible to treat depression and anxiety effectively and live a happy and productive life.